Good afternoon, everyone. I'd like to thank you for coming online with us today. We're excited to have Dr. Cassandra Olds with us. A little bit about me. This is my first time moderating today, so I am a little bit nervous. But I am Dr. Katie Klinda. I do smallmouth outreach and I oversee client services with the VDL. For those of you who are new attendees today, there's a few things we're going to go over. The first is a webinar scheduled as a 35 to 45-minute presentation with a question and answer following. There's two options for you to submit questions. The first would be doing the chat, which is a non-anonymous option. There's also the hands up. I think that's kind of located at the top of your screen. If you stay with us for the entire webinar, you are eligible for 1 hour of CE credit. We'll send those certificates out via email, but please give us 2 to 3 weeks to get those to your inbox. This webinar is recorded and it will be planted on KVDL's website and on the KVDL YouTube channel in about 2 weeks. In the next few days, we're going to ask you to fill out a survey. Please let us know what you liked, things that could be improved, and we're always interested in any future topic ideas you may have. Your feedback is extremely important to us, so please fill those out if you receive those. And now it's my pleasure to introduce today's presenter, Dr. Cassandra Olds. Dr. Olds did receive a bachelor's in microbiology and biochemistry from Rhodes University. She has a master's in veterinary science from the University of Pretoria, and then she has a PhD in microbiology from the University of Basel. Dr. Olds is a veterinary entomologist in the Department of Entomology at Kansas State University, where she has a research, teaching, and extension appointment. She works closely with producers and veterinarians to evaluate the impact of arthropod pests on livestock with the goal of developing sustainable pest control strategies. Her current research projects include studying Theileria orientalis transmission and impacts on cattle herds, as well as the economic impact of stable flies in feedlot cattle production systems. And I'm happy to turn it over to Dr. Olds for today's topic.
Wonderful, thank you. Lovely introduction. Very happy to be here. Most important thing is my email and phone number are on the slide. Please reach out at any time if you have any questions about anything veterinary entomology related. And this information is also on the final slide. So if you have been paying attention to the news, you'll see Theileria orientalis and the Asian longhorned tick has been present for a while now. And it's really because this tick and the pathogen have been moving westwards fairly rapidly in terms of what we would consider for an invasive arthropod. And so in red is everybody we had prior to 2024, and in blue we have 3 new states got added to the list just this year. And we're going to continue seeing this expansion as time goes on. So for those of us who are in Kansas and paying attention to the news headlines, you will know that we got our first tick identified and confirmed. We've been waiting for this for a while. We've known for a while it's coming. And honestly, I'm actually surprised it took us this long to find it. For those of you who are interested, what was found was a single larval tick from a dog in Franklin County. The dog had no history of travel. And because this is a larva tick, we think that the population is most likely already established. And so the question is, why has this really spread so fast, and will it spread throughout the state? And the short answer is yes. This tick is different to other ticks that we deal with, where a male and a female adult tick have to find each other on the same animal at the same time. And this is actually quite rare, because once a female tick inserts her mouth parts into an animal, she's glued in there. She can't go anywhere. And so she really relies on the chance encounter with a male of the same species, which means that you have to want to be on the same animal and on the same location on the animal. Our Asian longhorn tick, every tick is a female, and every tick will produce thousands of eggs. So she doesn't have to worry about this chance interaction of mating. They also have a very, very wide host range, which means they will happily feed on anything. So the chances of a tick reaching adulthood and then laying eggs is fairly high. And so this is why we tend to see not only large infestations, higher than you will ever see with any other tick, but this is also why we can see it moving so quickly. And anytime you bring an animal in, even if there is one tick on that animal, you could potentially establish a population. they will also feed on birds, right? And so if you have a bird flying over, you could get an introduction. So this concept of keeping the tick out is just impossible. And why we really care about it for the most part is because it transmits bovine theileriosis. And depending where you are, you either don't have it yet, or you're in the outbreak situation, and then we move towards endemic stability over time. And this is important because what we see clinically in the animals is quite different. So outbreaks happen when the pathogen is first introduced into an area. When this occurs, all animals are at risk, irrespective of age. We tend to see severe disease symptoms, which includes fairly high mortality rates. There are producers I know who have lost 20% of the herd during this outbreak scenario. And honestly, this is when clinicians are going to see the animals. So clinicians get called in when things are bad, right? Nobody calls you guys in for a visit when animals are happy and healthy. So this is normally what clinicians respond to, is this sort of outbreak scenario. Over time, this moves, so what you'll likely see is it's going to look very similar to anaplasmosis, except animals are not going to respond to treatment. Anemia and fever are kind of hallmarks of infection, but realistically, what you're going to see before the anemia is present, or you're noticing animals have a fever, is loss of appetite. These animals get really, really lethargic and dejected, and they will go off food. We immediately know once they're going off food that something is wrong. This is also associated with pretty significant weight loss. The exercise intolerance is fairly prominent. Animals are reluctant to move and seem to be battling to breathe if they do. Often we see animals coughing, their head hanging low, labored breathing. We do see late-stage abortions, and mortality rates can range between 2 to 5%, but can go as high as 20%. The 20% is usually when we have an outbreak scenario. When you go to more endemic situations, it's lower. Our impact on production is really not very well characterized here in the United States because it is fairly new. So the data that we do have comes from outside of the US. What it looks like is that you do have significant impacts on production in acute infection. So animals that are experiencing their first infection, if this is in a cow, you can see reduces in milk yield. But this is only in cattle who are symptomatic. So they did a really nice study where they had sort of animals who had disease symptoms and then animals who were infected and asymptomatic. And it's only the animals who had the overt symptoms of theileriosis where we saw this reduction in yield. We don't tend to see long-term issues with conception and calving. If the animal recovers, she seems to be quite fine. And then in our young calves prior to weaning, if they get an acute infection, if they get symptomatic disease, we do see reduced weight. This weight is not made up by the time they're weaned, but it does seem like after they wean, they can make that weight up pretty quickly and there's no long-term impacts. So we really look at the impact, which is quite difficult to quantify right now, but it's most likely going to be death loss and then animals who are undergoing their first infection. And then really once we overcome this initial outbreak, and what we've seen in reports is that the first year is really, really rough when you're dealing with that outbreak situation. And then as time moves on, it really manages to settle down pretty nicely. And that's when you're in this endemic stability stage. And this is when most animals in your herd are infected, but you have no clinical disease. Calves get infected when they're young. And for the most part, they tolerate it pretty well. And you really, in this case, should see almost no mortality and really mild disease symptoms. Now, the trick can be if you have a herd that is stable and you bring a naive animal into that herd, that animal can have outbreak symptoms, which would be severe. And so we strongly recognize that you've got to monitor these animals as they come into the herd. And even under endemic stability, just be aware of the impact of stress. We do see a very, very strong relationship between outcomes, whether an animal becomes symptomatic and shows disease symptoms, and the stress level of that individual animal. And this is because any stress event is immune suppressive. And so while happy, healthy animals can keep this parasite and maintain it for life, once you're infected for life, and be quite fine with it. If it acquires the infection and it is under stress, or it has a stress event later on in life, we can see relapses with severe disease. So we definitely want to keep an eye on animals, especially pregnant animals and calving animals. Shipping is a really, really big stressor, especially, in Kansas, we bring in a lot of stocker calves from out of state. A lot of these animals come from the East Coast, and they come from a place where this is endemic, and they're quite happy when they're at home. Just the stress of shipping can cause a relapse once they arrive here. Nutrition is so important. Keeping animals healthy is critical. Also, keeping them up to date on their vaccines, right? Don't make the immune response have to deal with things that it doesn't have to. And then flies, we see animals are visibly bothered by flies, but we don't often take into account the effect that this has. It causes significant increased markers in stresses for cattle. And so if they are battling fly populations, they can become more susceptible to other infections, including theileriosis. But the tricky thing that we tend to see is that clinicians see animals when they're sick and they're diseased, and sometimes have this is your only exposure to it, so we assume that this is always what is happening. But to be honest, infections often go unnoticed. So we surveyed 6 herds in Iowa, and the reason why we got called out there was because there was symptomatic infections on the cattle in P2, and significant mortality. 20% of the herd died during this outbreak. But these were the only animals that were showing symptoms, and these were naive animals who were brought in from out of state. And the producer at the time did not know that he had Asian longhorn tick on his premises, and put them into the pasture, and then saw this rapid outbreak occurring. But when we looked at the other herds that he had in the area, they were all already infected, and at a very high level. That's the 90 to 100% of his cattle were infected, and he had not noticed any disease symptoms in any of these animals. So outbreaks are, while they are what we first see, it really becomes the exception rather than the rule as we move on to endemic stability. And I think this is important for veterinarians to know, but also to communicate to your clients, right? That not every case is going to be an outbreak case. It is initially a little bit of a rough ride, but if we can get over this, it's stable, and it should be a fairly non-issue. In stable herds, we see 90 to 100% of the cows infected, and then almost all the calves are infected by 6 months old. And so in this case, none of these calves had overt disease symptoms, and everybody was very happy and healthy. There's no treatment. This is probably the most frustrating part of this situation at the moment. There is a drug called buparvaquone. It is not available in the US. It is curative, but it does not sterilize the infection, so animals will still remain chronic carriers for the rest of their life. It has a very long withdrawal period, but we do see that if it is given in conjunction with oxytetracycline, it does improve the outcome of the animals. Which brings us to long-acting oxytetracycline. So in other Theilerias, if given in the early stages of infection, it's very effective. Oxytetracycline does strange things to white blood cells and can inhibit proliferation of white blood cells. And our other Theilerias that are what we call transforming Theilerias actually have a stage in the white blood cell that does proliferate. We do not have this in Theileria orientalis. And so while we do have some anecdotal evidence that it helps, this is most likely as a supportive care, right? The animals do have significant issues breathing, and it's possible that tetracyclines help just calm down any secondary infections that the animal might have. And so it is not labeled for treatment, but it can be helpful as a supportive care. And then tolterazole was thought to be effective. Again, we kind of had anecdotal evidence that it was, when they looked at it in clinical trials, it was not likely, it did not show any impact. And so really the take home is we don't have a treatment option right now, and we will not have one in the future. So when we talk about how we're going to manage this, it really is from a transmission perspective, not from a can we cure animals once they have it. And so when we talk about transmission, we talk a lot about biological transmission. This is the Asian longhorned tick, or Haemaphysalis longicornis. It is the only competent tick in the United States. And parasite amplification occurs in the salivary glands. So the tick takes up the blood meal. The parasite has to do all sorts of replication stages and move out from the gut. But it gets to the salivary glands where it does replicate, and then it gets transmitted into a new host. We do not have transmission from an infected female to her offspring. So that's our saving grace. It is just transstadial. So a nymph will pick it up and transmit it during the adult stage. Just an important side note, because this tick is a clonally reproducing tick, we do have infestations larger than you will see with any other tick. And these large infestations alone can cause significant production losses. Also, as we're concerned about the New World screwworm coming in, this is something that we're going to want to keep an eye on. If you have large infestations, it can produce a site of where the New World screwworm could potentially invade. So what does it look like? It's a nondescript brown jobby. It could often be confused with the brown dog tick. It's got that same sort of reddish brown coloration. It looks very similar to other ticks in that we have a larval stage, a nymph stage, and an adult stage. It gets progressively bigger over time. And if you are wanting to know if you have it, send us our ticks. We are happy to identify any ticks that you may collect. Alternatively, I can walk you through how to identify them yourself. But critically, infestations may actually go unnoticed initially. So in Iowa, when we got called in, the producer said, well, I know for sure I've got it in 2 pastures because there's just ticks everywhere. And so we got 3 species of tick in these pastures, but you can see that the numbers of Asian longhorn ticks were just astronomically higher than any of our other ticks that we found. But much like we were surprised to see that other herds were infected, we were also surprised to see that other pastures were infected. So we looked at 3 other pastures in the surrounding area, and we found Asian longhorn tick there. Lower numbers, but it was already there. And so this is something where you're going to see over the next couple of years in that location that population is going to increase. So we may not find it initially. You may only notice it once we've reached the infestation levels. And honestly, if we look at Kansas, we probably already have it in places. It's just at this low level at the moment. And you'll know it when you see it, because there are going to be ticks everywhere. I cannot even describe to you how many ticks. You will climb out of the vehicle and you will be covered in ticks. They will bury themselves on the seed head often, and you can have them sort of lined up like fighter jets on one of those aircraft carriers, just all choo-choo-choo-choo-choo. In any crack in the grass, they just stack up there. So huge infestations. People will probably notice them on the animals first. Again, infestations that you have never seen with any other tick species. They're not too fussy about where they want to be, but they do like to congregate. So they will congregate in certain areas. Ticks have to make sure that the blood that they eat keeps on flowing, and that works best when you have friends around you who can also put in all these wonderful bioactive molecules in the saliva, so they co-feed in areas. So you'll see these patches, you see it in the ear, the tail head, in between the legs, udders and dewlaps. We also see that fairly prominently. And you may not notice this as much in a dark-haired animal, or especially a long-haired animal. So make sure that if you have clients who have these breeds, that they're physically feeling their animals fairly frequently to make sure that they are detecting any infestations. And please, we'll be more than happy to send us your ticks, send them in some ethanol, and we will identify them for you. And so that's the biological transmission, which is what we tend to focus on the most. But there is also mechanical transmission. And so there are a couple of known mechanical transmission routes. So sucking lice, the long-nosed cattle lice, which we have here in the United States, has been proven to be a vector in both Japan and Australia. We don't know how good it is, right? It's probably not as good as the tick, but it can still do it. In the Australian study, 100% of the calves were found to be infected within a couple of months. So it is possible. Vertical transmission, so if you have a cow that is positive, will she pass it on to a calf? Very low chance, so we're looking at the 0 to 2% range within 48 hours. There was a study out of Japan that said it was much higher, but it took the animals a significant amount of time to become positive. So, and they didn't control lice populations. So I actually think that what we saw there was lice transmission. So I think safely we can say it happens probably about 2% of the time. And then needle transmission. This has been shown to be possible. It's fairly low volume of blood, but the key thing is that the smaller your inoculum is, the longer your pre-patent period, and you honestly may not even see any symptoms of infection. In this case, it's pretty low. So just be aware that we do have needle contamination, and so using the single needle policy is worthwhile for blood draws and things like that. Now, potential vectors. This is something that I think is probably happening more frequently. Speaking to some folks in Virginia, they had seen this where they were getting infections in herds, but the tick wasn't there. We've seen this in Kansas when even before we had the tick vector, we had local transmission within cattle, and we were trying to figure out what this is. And we think it's probably stable flies, although other biting flies may play a role. And so these are, you'll see them on the legs of the animal, on the belly. And this is when you see cattle that are stamping a lot and fairly agitated, these are the stable flies. It vectors Anaplasma marginale, and so there's a strong chance that this is what is happening. And we actually found Theileria orientalis DNA in the mouth parts of stable flies and also in their guts. And this is important because stable flies are really painful feeders, and so about 3/4 of feeding events get aborted. And so if you have a mixed infection in your herd and you have an animal who is infected, we strongly suspect that the flies can pick up this infection and move it to new animals. And so we're applying for money to get this funded to test this out. But I'm pretty convinced that this is what is happening. And so as we move forward, this is the tick is coming. The tick will invade at least half of Kansas probably over time. Even if the tick doesn't expand into sort of western Kansas, we still have ulterior ways that this can get around, especially if we can show that biting flies are doing this. So this is not something that's going away. So what we need to start thinking about is establishing our plans and protocols for how we manage this moving forward. And the most important thing is going to be test herds. This may seem like a trivial thing. Well, if there's no outbreak, why should we be testing herds? Well, really, if you don't know what is there, you cannot even begin to manage it, right? And so in speaking with producers from all across the nation, sort of the concept of, well, I don't think I have it because I don't have any disease. And then I say, well, have you tested your herd? And then they test their herd and their herd comes back positive. So testing, even in the absence of outbreaks, is very important to just know where the baseline is for clients moving forward. And then you can really have 3 options, right? You have an infected herd and the tick is present. You have an infected herd, but no tick is present. And then the third option, which is no infections and no tick, which realistically is not going to be an option for many people in the future. So if the tick is present, you really, really want to be careful when introducing cattle from another area, especially if these cattle are coming from a place where there isn't a history of theileriosis, because this is going to be a naive animal moving into an established area. So test any animals before they enter the herd and really avoid introducing uninfected cattle, right? If the herd is positive and there's ticks in the area, you probably want to bring in animals who have already been exposed to this because they are more likely to not have severe outbreak symptoms of infection. And then just really closely monitor these animals that are coming in. And you want to manage the tick population, but you really want to keep it present but manageable, which is kind of different to this sort of, one's gut reaction is let's just get rid of all the ticks. But once you have endemic stability established, you want to maintain that. And the only way to maintain that is to make sure that there is some level of tick presence so that you have these calves getting infected when they're young, maintaining a healthy herd as you go on. And there's really two ways that we want to control this tick. It's pasture control and then on animal control. And so burning, not many states burn as much as Kansas burns, but really this is a really, it's probably going to be our best tool moving forward. My lab has done studies that show that burning significantly reduces tick populations, especially in the spring. If you can get out there early, before, I would say if you can wear a t-shirt, it's too late, right? Anything above sort of 50 degrees, ticks start coming out and being active. So burning early in the spring when they're in that vegetation overwintering is very, very impactful. Clear brush and hedges, these produce high humidity, which the Asian longhorn tick specifically really enjoys. Keep grass short. You want to expose ticks to heat and cold and drying out wherever you can. And then rotation. This is not going to be something that is effective for everybody. Not everybody has pastures that they can just say, well, I'm not going to graze this pasture this year. But if you do get a severe infestation, we do recommend removing animals from that pasture. And we've got a little example here. This is a fence line, and we had a huge infestation on the right. 95% of the ticks were Asian longhorn ticks. On the left, we had an equal mix of 3 species, and there were really very few ticks, even though for a tick, that tree area is a better environment. And it all comes down to hosts. In that tree area, we just had some bunnies and maybe the occasional deer, whereas on the right, we had a whole herd of cows and calves, and it just provides a buffet, right? And these are clonal reproducing ticks. The more food you give them, the more that survive, the more that go on to lay eggs. So if possible, removing animals off for at least a year can kind of calm that situation down a little bit. Resist the urge to spray. This is the thing that producers really, you know, if I've got an infestation, I'm just going to spray it. It doesn't work. Firstly, you have to cut the grass really short. You see the tick in the little red circle is up there on the head of the grass, but it will migrate down to the bottom of that grass stem. And so your insecticides just isn't getting at it. It's also going to kill off any beneficials that you have in the area, pollinators, dung beetles, things like that. So it really is the nuclear option that doesn't even work. So if you can dissuade that, that would be fantastic. And so on animal control, you really want to integrate your fly control and your tick control programs. And this is really important as we move forward, right? Horn flies cause significant economic losses. We are going to lose more money to horn flies than we will ever lose to Theileria orientalis. And so sometimes the gut reaction to control the Theileria situation sets you up for failure in terms of future years with horn flies. Also, as we have the potential threat of the New World screwworm, we really want to make sure that we're not doing things that will inadvertently cause issues moving forward. So use your veterinary entomologist. If you are not from Kansas, check if you have one in your state. If you don't have one in your state, feel free to reach out to me. And so we really recommend a 3-year rotation. So this is for flies or ticks. Year 1 using organophosphates, year 2 using organophosphates, and then year 3 switch out to pyrethroids, and then move back to organophosphates in year 4. This slows down the rate of resistance. This is so critical. We are not getting new products on the market, and evidence that we do have shows that even if we get new products, flies are already resistant to them. So we really, this has to be paramount when we talk to clients about what we're doing for flies. And so if you are in an organophosphate year for fly control, whatever you do for ticks has to be an organophosphate. So we want to make sure that we're keeping fly and tick control programs aligned. If a producer is in the situation where organophosphates are starting to falter, you can move to a single year rotation where we use organophosphates in year 1, pyrethroids in year 2, and then macrocyclic lactones. We've had to introduce this because of resistance, so this is really don't take this step lightheartedly. We really want to make sure we can keep option 2 for as long as possible. So ear tags, only effective if the cattle have ticks in the ears. This is not going to protect an animal if there are not ticks in the ear. Sprays are a really great bet because we have a lot of options, especially for pyrethroids, to a lesser extent organophosphates. You do have to spray the whole animal, right? So having a spray race is optimal because then the animal will get exposure across the whole body. It's not going to kill ticks that are not directly sprayed with the product. Which brings us to pour-ons. People love pour-ons because they're super convenient. But macrocyclic lactones are absorbed into the body, so will be available for ticks that are not along that back line to consume. But please only use this if you have a high infestation. We want to keep this macrocyclic lactone use as low as possible. Get a good weight on the animals and make sure that the whole back line is poured. Don't use a pyrethroid pour-on. It will only protect the top line. If you speak to the chemical companies, they'll say, oh yeah, within a certain amount of days, you can detect pyrethroids on the heel of the animal and stuff like that. Our experience has been when you have an infestation, you can pour them with pyrethroids and it doesn't work. Pyrethroid spray, thumbs up. Pyrethroid pour-on, not so much. And so we really want to think of the long game here. Macrocyclic lactones are fat soluble, so we have a really long excretion time. And so even if we give an oral or a pour-on, we're looking at a month to 5 months if you give an injectable, for example. And it will kill every adult dung beetle and every larva dung beetle, the entire grazing period. And as producers are becoming aware that their options for fly control is limited, they really are wanting to reestablish these dung beetle populations, and this will never occur if we keep using these ivermectins. And by all means, please avoid using injectable products for ectoparasite control. We just see ridiculous levels of resistance occurring with it. Good news is animals will build immunity to ticks over time. You can see on the left we've got ticks that were fed on a naive calf, and then on the right on a pre-exposed calf. And you see that you do get this sort of natural resistance occurring over time. And in people where they've been dealing with this for a couple of years, have honestly said, yeah, year 1 was bad, year 2 was but we're 3 or 4, 5 years out of this, and our tick infestation levels are no higher than they were prior to this whole event happening. So things will get better with time. We just have to kind of see it through. Medgene does have an anti-tick vaccine. It is a prescription vaccine. We do not have efficacy data on it as to how well it works, but just so that you know, that is an option out there. If the tick isn't there, you still want to be careful and test any animals entering the herd, especially because we've got this potential for fly-based transmission. We know lice transmission occurs. So you want to make sure that you know the herd status as well as any new animals that you bring into the herd. Closely monitor any animals that arrive for disease symptoms, and then just make sure you're monitoring those alternative transmission routes. And then lastly, no tick, no pathogen, no problem. I mean, this is kind of what people want. I don't want any of it, but just be aware that if clients are in a region where the tick could possibly invade, this is not a viable solution, right? We cannot bury our heads in the sand. What we really want to do is say, hey, this is coming. Let's set up our protocols now so that we know what we're on the lookout for, so that we have that good client relationship, veterinarian relationship, so that we can weather that first year that may be a little bit rough. If neighbors have infected cattle, flies fly. So even if a client's herd is uninfected, chances are it will get to the point where we're like Virginia, where almost every animal in the state is infected. And so really keeping it out indefinitely is just not feasible. So how can we bring it in on our own terms and do this safely? This tick will feed on humans and pets. I mean, our Kansas tick was found on a dog. A lot of pathogens have been found in it, but realistically, the only one that it's been shown to be competent vectorially is Rickettsia, but really field infection rates are really low. And so we recommend the same thing: reduce exposure, take a tick that you find off immediately, keep it in the freezer for 2 weeks, and if you don't have any weird flu-like symptoms, just feel free to get rid of it. And then lastly, just to kind of wrap up, I think clinicians especially have a really important role to play in this. It's really weathering the storm of this as we move forward as a community. I've spoken to a lot of producers trying to sell cattle. People find out that the cattle are infected and then don't want to buy it, and then they test their herds and find out that they already have it. So I really think we need to remove the stigma of having either the tick or the pathogen. Nobody has done anything wrong. This was an inevitable situation. We want to be vigilant but not panic. I've spoken to people who have said, well, their clinicians say, don't ever bring in infected animals. Realistically, that's not an option, right? We need to get to a point where we can know what a herd status is, and then make really good educated decisions, and then weigh up risks and have a plan for managing it as we go forward. So really what we're trying to urge is that people buy and sell cattle as usual. Resist the urge not to purchase infected cattle, especially if you don't know if the herd is already negative or positive. So just really making good educated guesses rather than that knee-jerk reaction of let's keep it out at all costs. And lastly, I know it's a lot to take in a short period of time. Ideally, something like this would go on for a couple of hours. So if anything was unclear or you have any questions, feel free to reach out anytime. That is my extension phone number. If you don't get me, leave a message, and by all means, send me an email anytime.
All right, we have a couple of questions here. First one, is there any work being done to get buparvaquone approved in the US?
You know, initially my sort of gut reaction was like, let's get buparvaquone in here because, you know, it works. And from what I've been told, it's not going to happen for a number of reasons. The demand isn't really there. The demand isn't high enough that sales of the product would be commercially viable. It has a really, really long withdrawal period. And for all intents and purposes, once you're over that epidemic stage, it becomes a non-issue. And so I don't think it's, unless everybody bands together and says, hey, we really, really want this, and we will buy it if it is available, I don't see it happening.
Okay, so we've got another question. Is whole herd testing required, or can you test a representative sample of the herd, and if so, what percentage?
Yeah, I love this question, and I hate this question at the same time. Because honestly, we don't know, right? In an ideal situation, you test the whole herd and you know. If the herd is 100 head large, you're not going to test every animal, right? So it really depends. It comes down to the client's resources. If they're happy to test the herd and they have 3 or 4 animals, sure, test all the animals. What it really comes down to is probabilities, right? So in an endemic region, we'll have 90 to 100% of cattle infected. You could get away with testing 10 to 20% of that herd, especially if it's a large herd, right? If there's only 5 animals, then I would say test 5 animals, because there's a chance that if you just test 1 animal, you're going to miss it. So it's this weird interplay between the size of the herd and where you are. I would say that if it is a herd where animals have been moving in, I would prioritize testing new animals, right? If you got a cow 2 years ago and it came out of New York, right? That's an area where it's known to occur. Test that one versus the cow who was born and bred 10 years ago in Kansas. And so once an animal tests positive, it is infected for life. You do not ever need to retest that animal. So if somebody wanted to sort of test multiple years, I don't retest the same animals, test a separate batch. But I would say a good rule of thumb is in a herd of 50 animals, I would test 5 to 10 animals. Smaller herds, I would try and test as many as possible. Really, really big herds, you know, I think if you can get to the 10%, 20% would be ideal, but I think 10% would give you a fairly good idea if it's there.
Okay. I have a question about moving hay, and that a lot of hay shipped in the U.S., would that spread the ALT ticks as much as moving the cattle?
Yeah, so it's tricky, right? So if probably it depends. We see highest infestations on pastures where cattle are present. Now, if it is a pure hay field, risks are probably lower than if you're moving cattle around, right? Because maybe there's a bunny or two, or there's a deer who occasionally go across. Does it survive the winter? Who knows? So I would say hay risk is fairly low. The producer in Iowa that we talked about, he moved the cattle off and he was really reluctant. He was like, well, I don't want to lose this grass. Can I bale it and give it to the animals? And I said, well, sure, you can bale it, but just think about when you're feeding it, right? You want to be feeding that hay in the dead of winter, because as the hay gets eaten, it's going to distribute, the ticks are going to be exposed to those really, really, really cold conditions. If you're in a dry lot situation, that's safer, right? You don't have these refugia where ticks could potentially escape to if you had a weirdly warm day in the middle of winter. And so I think that it's hard to know right now because we haven't really had opportunities to check these things, but I would say that transport of hay, if it's hay that was grown purely for the purpose of growing hay, probably low risk. Hay from an infested field, higher risk, but I still do think there are ways that you can get around this, especially if you're in a region that already has the tick, right? Then you're just moving it from point A to point B in the same infestation area.
Okay. How is Theileria moving into areas without ticks?
So I think what's happening is we're moving infected cattle. So the cattle coming into the area, the cattle are infected, and then I really do think that it's the flies. If you look, I mean, Kansas, we're great in a lot of things, but we have probably highest fly populations I've ever seen anywhere else. Kansas and Nebraska, we got flies. And so I think that when we're bringing in these, especially when you start bringing in out-of-state cattle, and then this animal is in the herd, and then the flies, just by sheer numbers. And I always say this, a stable fly doesn't have to be a good vector if you've got 200,000 of them coming out of a hay bale every single week, right? And so it's just sheer numbers. So you don't have to be good at something if numbers are on your side. And so that's what I think is happening. We've brought in infected animals for years and years and years because we were under the assumption that we don't have the tick or whatever, it's fine. And now we're starting to see local transmission. On the bright side, we don't see outbreak symptoms where we've, for the most part, had this fly transmission. And so I think because the flies are bad at being vectors, the cattle are getting a low dose, which means that their immune response behaves appropriately and they are then protected.
All right, another question. As far as the ticks, we're starting to see the few in Kansas. Do we have any projections or a timeline of when we're going to start seeing those active infestations?
No, and you know, it's tricky because to do that, to know how quickly it spreads, you have to be fairly intensive in your sampling. And we honestly just have not been given the resources to be able to do that. There are other states that have done a great job. Virginia has done a really great job of sort of plotting as counties became infested. But you know, if that is something that producers and veterinarians are concerned about, and we can rally resources to do that, we can do that. It's just we don't have resources. And for the most part, I don't know that it's necessarily terribly useful, because you can have this prediction of how quickly it will move naturally, but then an animal brings in a whole infestation. And so it can be somewhat erratic. Chances are at least half of the eastern half of the United States. The tick is sticking to the projected climate models. They did modeling to see where they thought it would be, and about half, the eastern half of the state is probably good enough of a environment for this tick. In other states, it's stuck to this, and so we can probably assume that. I would say, in speaking to the folks in Virginia, they're about 8 years since it first was there, and they now don't have places where there aren't any ticks. Different climate, don't know if it will go that quickly in Kansas. It's all a bit unknown at this point.
Okay, we have another question here. Is there any research or information about how small ruminants are being affected?
So not much attention has been given to small ruminants. It seems that what the little information I could dig up on this was that technically they could be infected, but that they show no signs of infection. So this is not something that we're worried about in terms of theileriosis. So the reason is that, so the first step of the Theileria life cycle is to go into a white blood cell. And to do this, they need specific markers. And so cattle white blood cells and other ruminant white blood cells are different enough that those markers may not be there. So we don't anticipate this being an issue for small ruminants. Now, if you get an infestation of the tick, that can cause production issues. But from a Theileria perspective, not too concerning.
Okay, do we know where the Theileria started or how it got here to the USA?
Yeah, so it comes from Asia. Both the tick and the pathogen come from Asia originally. Before it got to us, it actually got to Australia. Australia and New Zealand both got it going to them first. It probably, I mean, it could have come in any number of ways. It could have come in, and the tick and the pathogen probably didn't come in together. We probably had multiple invasion events. So, for example, anytime we were bringing in cattle from, Asia or something like that, and animals infected, it wasn't a disease that we cared about, and so it wasn't really on the radar. It's not one of those things that an animal has to test negative for, and so that could have been brought in multiple times. We then could have had local transmission, be it through needle, lice, potentially flies, and then the tick could have been brought in, from humans traveling, companion animals. Could have even have been brought in livestock, and it's there's a statistic out there about the number of invasion events that have to occur before an invasive population is set up. And it's actually, we probably had multiple events of invasion, and it could have happened at multiple time points. But when we sort of backtrace testing cattle samples over time and going back from the sort of 2017 official date, animals were positive before that. And then when they looked at some old tick records, they found older ticks there. So who knows, anywhere. Now that it's here to stay, and we just have to make the best of the situation. And this is something that we're going to see as humans travel more, as animals travel more. This concept of invasive pathogens and insect pests is going to become an issue again and again. And so in a way, we can use Theileria as, okay, what's our action plan? How do we have those good relationships with clients? What are we anticipating coming in the future, so that we stop being reactive and start being a little bit more proactive?
All right. Looks like we got most of our questions answered there. I just want to thank everybody again for taking time away from your busy day. We will have another webinar coming up here soon. And again, thank you for being with us today.